If you are waking up 2 or 3 times every single night to use the bathroom, or if you feel like you are constantly hunting for a restroom every time you step foot out of the house, there is a very high chance the problem isn't just your age. Millions of seniors over 60 are convinced their weak, irritable bladders are just an inevitable part of getting older. But in my clinic, I see something else entirely every day. Right now, a pill sitting in your weekly pill organizer, one your doctor prescribed to protect your heart, your joints, or your mood, might be quietly irritating, weakening, or completely hijacking your bladder. I am Dr. Carl, a urologist who has spent the last 16 years treating bladder and urinary conditions in thousands of older adults. Today, we are going to walk through 5 common, everyday medications that secretly damage your bladder, cause urgent accidents, and keep you awake all night. Pay extra close attention to number 4, because it is a very common over-the-counter pill that millions of retirees take every single morning for stiffness, completely unaware that it is triggering bladder spasms and constant trips to the toilet. By the time we finish today, you will know exactly what to look for in your medicine cabinet and how to talk to your primary care doctor about fixes that don't involve suffering through broken sleep or ruining your afternoon on the golf course. Before we dive into the first medication, I want to ask you a quick question. How many times are you currently getting out of bed to urinate on an average night? Drop your number in the comments below right now. Whether it is once, 3 times, or 5 times, I read every single comment, and your answers directly shape the topics I cover in these videos to help you get your life back. Let's start with number 1 on our list. Water pills, known clinically as diuretics. You might be taking hydrochlorothiazide, furosemide, or Lasix. Primary care doctors and cardiologists prescribe these constantly to help manage high blood pressure or to clear up fluid buildup and swelling in your ankles and lower legs. They are fantastic for your heart and blood vessels, but they are an absolute nightmare for your bladder if the timing is off. Think of your bladder like a soft, elastic storage balloon and your kidneys as the water tap. Normally, your kidneys fill that balloon at a slow, steady trickle throughout the day. But when you take a water pill, it forces your kidneys to open that tap all the way up. It dumps massive amounts of fluid into your bladder in a very short window of time. If your bladder muscle is already a little sensitive or thinned out from getting older, that sudden, rapid stretch triggers a powerful emergency signal to your brain. You have to go right now. It causes intense urgency, severe frequency, and often nighttime leaks if you take that pill too late in the afternoon. Research published in major urology journals has consistently shown that loop diuretics are one of the leading drug-related causes of urinary incontinence and nighttime waking in seniors. But here's what you can do this week. Look at the exact time you swallow your water pill. If you are taking it at dinner or late in the afternoon, you are essentially guaranteeing a night of broken sleep and trips down the hallway in the dark. Talk to your doctor about shifting your dose to early morning, right around breakfast. This allows the heavy fluid rush to pass while you are wide awake and near a bathroom during the day, giving your bladder a break once you hit the pillow. Just remember, never stop or shift a heart medication without having a quick conversation with your prescribing doctor first. Moving on to number 2, blood pressure medications, specifically a class called alpha blockers. You might know them by names like doxazocin, terazosin, or prazosin. Interestingly, these drugs are often prescribed to men for an enlarged prostate, but they are also frequently given to both men and women to treat stubborn high blood pressure. They work by relaxing the smooth muscle tissues in your blood vessels so your blood can flow easily, which drops your numbers down into a healthy range. The problem is that your body doesn't isolate that relaxation to just your blood vessels. Your bladder relies on a ring of smooth muscle at the bottom, called the urethral sphincter, which acts like a tight rubber band, keeping the valve closed until you are sitting on the toilet. Alpha blockers relax that valve too. When that smooth muscle gets overly relaxed, the valve can't seal completely shut. If you cough, laugh, sneeze, pick up a grandkid, or swing a golf club, the pressure in your belly pushes against that weakened valve and urine leaks out. This is what we call stress incontinence, and it catches many active retirees completely off guard. Clinical studies from the American Urological Association highlight that drugs affecting smooth muscle tone can directly impair bladder outlet control, particularly in older women who already have weakened pelvic floor muscles. If you notice that you are leaking small amounts of fluid during normal daily activities after starting a blood pressure or muscle relaxing pill, don't just accept it as part of getting older. Write down when the leaks happen and bring it to your next Medicare wellness visit. Your doctor can often switch you to a different class of blood pressure medication, like an ACE inhibitor or an ARB, which manages your pressure without loosening the seal on your bladder. That brings us to number 3, antihistamines and sleep aids. This includes over-the-counter allergy medications like Benadryl or nighttime sleep aids containing diphenhydramine. Many seniors take these every single night to fall asleep or to deal with lingering sinus issues. They seem completely harmless because you can buy them right off the shelf at your local pharmacy without a prescription. However, these drugs carry what doctors call strong anticholinergic properties. In plain language, they block a key chemical messenger in your nervous system called acetylcholine. This chemical is responsible for telling your bladder muscle to contract and squeeze urine out when you want to go. When you block that chemical, your bladder muscle becomes sluggish and lazy. It forgets how to squeeze efficiently. Instead of emptying completely when you go to the bathroom, your bladder leaves 2, 3, or 4 ounces of stale urine behind every single time. This is called urinary retention. Because your bladder is never truly empty, it fills back up to the brim in just an hour or two, leading to that maddening feeling of needing to go constantly, yet only producing a weak, tiny dribble when you sit down. Even worse, that leftover urine acts as a breeding ground for bacteria, vastly increasing your risk of painful urinary tract infections. Reviews from major medical institutions like the Mayo Clinic consistently warn against the chronic use of strong anticholinergic medications in older adults due to their heavy impact on both bladder retention and memory function. If you are taking a nightly sleep aid or an older allergy pill to drift off, try stepping away from them this week. Talk to your pharmacist about safer, non-anticholinergic alternatives, or focus on simple sleep hygiene like keeping your bedroom cool and shutting off screens an hour before bed. Now, let's take a quick pause right here. If this is connecting the dots for you today and helping you understand what might be happening inside your own body, please hit that like button right now. It takes half a second, but it tells the algorithm to push this video out to thousands of other seniors who are struggling in silence with bladder issues. And drop a comment below, letting me know, are you currently taking any daily medications for sleep or blood pressure? I'd love to know what you are dealing with. Now, let's get to number 4, the one I warned you about at the beginning of the video. Over-the-counter pain relievers, specifically NSAIDs like ibuprofen, naproxen, or Aleve. Active retirees take these constantly for arthritis, knee pain, lower back stiffness, or after a long day of gardening or pickleball. They are incredibly common, but few people realize what they do to the lining of the bladder. Your bladder is lined with a delicate, slippery protective layer called the glycosaminoglycan layer, or GAG layer for short. Think of this layer like a non-stick coating inside a frying pan. It keeps the acidic, irritating waste products in your urine from touching the raw, sensitive nerves in the bladder wall. NSAIDs work throughout your body by blocking enzymes that create pain signals, but those same enzymes are vital for maintaining blood flow and mucosal protection in your bladder lining. When you take heavy doses of NSAIDs over weeks or months, that non-stick coating wears down. The acidic urine begins to burn the underlying bladder tissue directly. This leads to painful bladder spasms, a sudden, burning urgency to go, and severe nighttime frequency. Observational studies in urology research have linked chronic NSAID use to increased symptoms of lower urinary tract irritation and overactive bladder. If you rely on these pain relievers every single day just to keep your joints moving, bring this up with your doctor. Ask about topical anti-inflammatory gels that absorb through the skin locally rather than traveling through your bloodstream, or discuss physical therapy and non-drug options that relieve joint pain without stripping away your bladder's natural armor. Finally, number 5. Prescription pain medications, specifically opioids like tramadol, oxycodone, or hydrocodone. These are often prescribed after a hip replacement, knee surgery, or for severe chronic back pain. Opioids are powerful nerve deadeners. They slow down everything in your body. They slow down your gut, causing severe constipation, and they completely paralyze the normal nerve signaling in your bladder. When you are on an opioid, your brain simply stops receiving the signal that your bladder is filling up. The bladder keeps stretching and stretching, holding well beyond its normal capacity. Eventually, the pressure becomes so extreme that the urine simply overflows past the valve, leading to sudden, heavy leakage without you ever feeling the urge coming on. Urologists call this overflow incontinence. Furthermore, the severe constipation caused by these drugs creates a hard mass of stool in your bowel that physically presses directly against your bladder, crushing its capacity and making it impossible to empty. Clinical data from surgical and pain management studies show that post-operative urinary retention is overwhelmingly tied to opioid use in older adults. If you are taking prescription pain medication following a procedure or for chronic pain, your top action step this week is to proactively manage your bowel movements. Take a daily stool softener, drink plenty of water, and ask your doctor about transitioning to non-opioid pain strategies as quickly as safely possible. Keeping your bowels regular takes the physical pressure off your bladder instantly. To show you how all of this comes together in real life, let me tell you about a patient of mine named Arthur. Arthur is a 71-year-old retired accountant who lives down in Sarasota, Florida. He loves playing doubles tennis, spending time with his grandkids, and driving up the coast with his wife. But when Arthur came into my office last year, he was miserable. He was waking up 4 to 5 times every single night, leaving him exhausted during the day. He had stopped playing tennis altogether because he was terrified of having a sudden leak on the court, and he wouldn't go on road trips without planning every single bathroom stop along the highway. Arthur thought his prostate was failing or that he was just getting old. But when I looked at his chart, I noticed two things. 3 months earlier, his doctor had started him on a daily NSAID for knee pain, and he was taking an over-the-counter sleep aid containing diphenhydramine every night to cope with his insomnia. His bladder was getting a double whammy. The sleep aid was preventing his bladder from emptying completely, and the daily pain pill was irritating his bladder lining. We made a simple plan. With his primary care doctor's blessing, we stopped the nightly sleep aid and replaced it with magnesium and proper sleep habits. We switched his oral pain pill to a targeted topical gel for his knee. Within 3 weeks, Arthur went from waking up 5 times a night to just once. His bladder urgency vanished, his energy returned, and 2 months later, he was back on the tennis court in Sarasota, completely leak-free and back in control of his life. Arthur didn't need invasive surgery or expensive new prescriptions. He just needed to clean up the hidden bladder triggers in his daily routine. If you want to take control of your bladder health starting tonight, here is your simple 5-step action plan. First, pull out every single medication, supplement, and over-the-counter pill you take and lay them out on the counter. Second, check your list against the 6 culprits we covered today: water pills, alpha blockers, antihistamines, NSAIDs, antidepressants, and opioids. Third, adjust the timing of your water pills so you are taking them early in the morning with breakfast, never late in the afternoon or at night. Fourth, stop taking over-the-counter nightly sleep aids containing diphenhydramine and talk to your pharmacist about safer alternatives that don't paralyze your bladder muscles. Fifth, schedule a 15-minute medication review with your primary care doctor or urologist. Bring your exact list of pills and ask them one simple question: could any of these be contributing to my bladder symptoms? Now, checking your medications is a massive first step, but what if the food on your dinner plate is making things twice as bad? In my next video, I am going to reveal the top 3 seemingly healthy breakfast foods that actively burn your bladder lining and force you to run to the bathroom all morning long, including one popular fruit that almost every senior thinks is good for them. I am Dr. Carl. Stay well, live actively, and I'll see you in the next video.